3, Nancy Beth Cruzan versus the Director of the Missouri Department of Health. Mr. Colby.
Thank you, Mr. Chief Justice, and may it please the Court. Nancy Cruzan is a 32-year-old Missouri woman who is in a persistent vegetative state. Persistent vegetative state is a specific clinical diagnosis for a patient who is permanently unconscious. All thought, all memory, all ability to interact with the world around her in any way is gone. It is undisputed in the record below that Nancy will never recover from this condition and will never interact with the world around her. She's been in this condition for over 6 years, the result of a car accident. Approximately 3 weeks after the accident, when hope for her recovery remained strong, her parents and her husband at the time consented to the surgical insertion of a gastrostomy tube necessary to feed Nancy. No one told the Cruzans at that time that their consent was irrevocable. No one suggested to them that the purpose of the surgical insertion of the tube was to perpetuate Nancy in an unconscious state indefinitely.
Mr. Colby, is it clear, and I'm not sure, it seems to me that there may be some dispute on the point as to whether she could have been fed manually if that had not been done. Apparently, your opponents say that it would have been more difficult, but that she could have been fed manually by massaging the food down her throat or something of that sort. Is that correct or not?
I think that it is not correct. At the time the tube was inserted, Nancy had just come out of intensive care. She was being fed through, it's not completely clear in the record, but it appears both a nasogastric tube and through an IV tube. It was clear that her long-term care was going to require more nutrition, and the operational report for the surgery stated that the reason for the surgery was malnutrition. After the tube was inserted, when she transferred out of the hospital and into the rehabilitation center, they attempted to feed her through mouth while she still had the tube in place, but they were not able to feed her sufficiently to provide for her needs.
Mr. Colby, at the time the family said, yes, go ahead and insert the feeding tube, if they had refused that permission, would the state law have required that refusal to be honored? Was the family's consent required at the time for the insertion of the tube?
The family's consent was required for the surgery to insert the tube.
By state law? By
state law, it would have been...
Is that by statute or by some state common law?
By common law, it would have been a battery for the doctor to perform a surgery without consent, and the only statutory exception to that in Missouri is in the event there is an emergency, and that's defined in the Missouri statute as a person is in imminent danger of dying and there was no one around to provide the necessary consent.
Well, what if they refused? Is there a procedure then whereby the state would go in and have a guardian appointed? Or does the state, if the patient is in a state hospital, simply accept that refusal and allow the patient to die of malnutrition?
It is my belief that had they refused, the state would have accepted that refusal, and that Nancy would have died not from malnutrition, but from the severe brain damage from her accident shortly before then. Had the doctor advised...
Is that a prediction of fact, or is that a statement of law? You say it's your belief that they would have accepted it. Would the state have to have accepted it? I mean, suppose the parents were Christian Scientists or for some reason did not want a relatively ordinary surgical procedure to be performed. Would the state have to accept that determination, or would the state not be able to appoint a guardian and have the guardian make it?
The state would not necessarily have to accept that determination, and certainly there are